Hi. In this lecture, I'm going to talk about assessing the communication abilities of individuals with right hemisphere damage, TBI, and dementia. Before I get into the details of the lecture, I just want to say that in general, I find sometimes understanding how to assess the kind of high-level language skills, discourse skills, the pragmatics of these patient groups to be difficult to wrap my head around, and that includes treatment. And I have a quote here in the notes from Dr. Connie Tompkins, who's an expert and researcher in right hemisphere communication disorders. And she basically says, we don't have a lot of good standardized instruments to assess the communication abilities of individuals with right hemisphere damage. The assessments that we have don't seem to have a real theoretical basis or an up-to-date theoretical basis. And in general, there's a dearth of research that can help guide clinicians in how to go about doing these assessments. And to some degree, that's true with traumatic brain injury too. In some ways, it's not. We shouldn't be surprised that these topics, the kind of problems people have when they have discourse problems or pragmatic problems, are difficult to wrap our head around because they exist at a higher level of language ability, in the sense that it's not so straightforward. Aphasia, the person with aphasia, their symptoms are oftentimes very obvious. Testing them, I think, is in some ways much more concrete. Not always, but in general. So I'm not going to go into detail on the different assessments. Your authors give a description of different testing instruments. In general, you will use the ones that are in the clinic that you work in. I find that SLPs that I've worked with, and myself included, rely a lot on informal measures, observation, when it comes to detecting and understanding discourse difficulties, pragmatic difficulties. I also think that we need to pay a lot of attention, not that we don't with persons with aphasia, but we need to pay a lot of attention to patients' complaints and caregivers' observations, because they can help us identify areas that are impaired, areas that are interfering with a person's ability to function out in the real world. But we need to be mindful that persons with right hemisphere damage and traumatic brain injury often have poor deficit awareness, poor metacognitive, metalinguistic abilities, and so they often or sometimes are not the best judges or reporters of what kind of difficulties they're having. In general, one of the ways that deficit awareness is kind of diagnosed is you compare the caregiver's observations about the kinds of problems and the degree that the person is having problems. You compare the caregiver's observations with the patient's observations, and if there's a discrepancy, then you consider that the patient may have poor deficit awareness. If your observations are in harmony with the caregiver's observations, then that strengthens the likelihood that your patient has poor deficit awareness. Finally, I want to point out that you'll notice that there's much more of an emphasis on right hemisphere disorder communication impairments in the notes here. The reason for that is that In general, a bulk of our assessment is focused on discourse and pragmatics with people with right hemisphere damage, but it also is with people with traumatic brain injury. And so conceptually, the understanding the process of assessment, the kinds of behaviors that we're looking for, or the kinds of impairments that we're looking for. In other words, the assessment of discourse and pragmatics and right hemisphere disorder and TBI are not significantly different. So there's more information in right hemisphere disorders, but that's applicable to TBI also. Probably the one area where we have some difference is that we're much more likely to see something like poor ability to produce or comprehend affect, emotional signals, whether they be facial expressions or prosody, and that's how we get aprosodia. And we don't see that really so much in traumatic brain injury unless we have more localized right hemisphere damage.